Hello everyone, welcome back. This is eclass4, which will cover material on the social service delivery system. This is the final e-class in Module 2. If you haven't already, make sure you go through all the other e-classes, including the special topic e-class, in preparation for your quiz and for your journal reflections. All right, to start, I'm going to give you an overview of what we're going to talk about in today's e-class. First, we're going to start with a little review for the quiz to give you an idea of what kind of material is going to be on it in order to help you better prepare. I'm also going to review the journal reflections to give you a better idea of what I'm looking for. And with that, I'm going to be posting a rubric on Canvas that will help you get a better idea of how I'm going to be grading these journal reflections so you can be sure that you feel that you've adequately addressed the material. We're going to go over the learning objectives for this e-class, reading review. Again, these are the key terms and ideas that will show up on your quiz. Social work's authority to act, so how we as social workers, kind of the auspices that give us the authority to do what we do. We're going to talk a bit about different social work service settings and what practice can look like in these different settings. We're going to talk about person-centered practice, so how we still maintain a person-centered, strengths-based approach even in bureaucratic systems. And we're going to talk a bit about the problem of fragmented service systems. We're going to watch a video with that, which I hope will help explain not only further explain why our systems are fragmented, but also ways that we could work to reduce fragmentation. Okay, so just give you an idea of what the quizzes will look like in this class. The format, they're going to be available on Canvas. They're going to be scored as well through Canvas, so you'll be able to check and see what questions you missed. Again, this isn't, you won't get the answers per se, but you can see which ones you missed, and then you can decide if you want to attempt the quiz a second time. So for the quiz, if you do attempt to take it the second time, the second score will be your final score. So the format, the questions will be multiple choice, true, false, fill in the blank. The material that was going to be covered in the quizzes are the key terms and concepts from chapters. Make sure you also pay attention to some of the examples of social work in practice that are available in each of the chapters. You know, when they give the little case examples, as there will be questions somewhat similar to that in a multiple choice format. There'll also be some material covered just in the e-classes and in the special topic e-class that will also be on the quiz. Again, these will still be in the multiple choice, true, false, or fill in the blank format. Time limit for these will vary depending on each of the quizzes. However, that will be shown to you before you start the quiz. And so you will need to complete the quiz within that allotted time period. However, the quiz is available from Friday to Sunday night, so you have plenty of time to take the quiz or take it a second time if you plan ahead. Okay, now to talk a little bit about the journals. So each of the journals, there are 7 sections that need to be answered. Again, see the syllabus as well as the template on Canvas. For each of those sections, you need to have at least 1 to 3 solid paragraphs per heading. And so what I mean by that is, you need to have paragraphs that are complete, 4 to 5 sentences per paragraph. They should address the questions that are given in the rubric in order for you to show your critical reflection skills. So even if you answer the 7, if you really only describe what's in the course materials, what was in the classes, things like that, that won't get you full points. I want you to really critically reflect on the material, integrate it with what you know, what you think about social work, and that will really allow you to get the full points. So the questions that are listed as examples are questions that you should be integrating into these paragraphs in order to get full points. And again, you'll see the rubric that I'll post, which will show you really what I expect in order to get full points on this. Okay, so the learning objectives for today's e-class are to understand and explain where social workers' authority to act comes from. So by the end of the class, I want you to understand where social workers get their authority from, and how our different settings, social work settings, kind of inform what kind of work we do and our rules and expectations as well. I also want you to be able to describe issues related to service fragmentation and options to reduce this issue. So the key terms and ideas that you should be familiar with from this chapter are public and private auspices, nonprofit and for-profit status, so the difference between those two, independent practice, sources of funding, so what kinds of funding tend to be available for social workers and social work practice, as well as how these funding sources can dictate practice, issues around privatization, social work credentials, as well as service fragmentation. Again, if you're not familiar with these terms, they seem a little fuzzy, make sure you go back and review those before the quiz. So before we dive in a little bit deeper into the different types of social service settings that social workers work in, I'm going to talk a little bit about social workers' authority to act. So we're going to start a little bit with the bigger picture. So where does the authority or the ability of social workers to intervene with families, clients who are experiencing crises, where does this come from? Well, it broadly kind of comes from two areas. The social service setting, so the organization or place that we're employed, as well as through the certifications or credentials that we have as social workers. And so I like to think of the example of Law and Order and lawyers to kind of illustrate this. So, for example, they talk a lot about on Law and Order, passing the bar examination and things like that. Well, just like lawyers have the bar examination that they have to pass in order to become actual lawyers, social workers have licensing exams as well. And these licensing exams should prove that we've completed and mastered the knowledge base, as well as have a firm understanding of social work values and ethics, and that we have a solid foundation in terms of understanding interventions, how to work with clients, and how to act and work as a professional social worker. And then our social service settings, or the agencies we work for, also give us the authority to act. So depending on the type of organization that we're employed by, their rules and operating procedures dictate a lot of what we do, but they also give us the authority to act. So for example, if you are working in the child welfare system, your ability to interact and intervene in with families who are in crisis, who the need to remove a child to a safer setting, things like that. The authority for you as a social worker to do that comes, again, from the fact that you are a social worker, but also from your organization's authority to act in this manner. And so we're going to talk a little bit more about the different types of social service settings and their kind of authority in the next few slides. So as a social worker, you could be employed in any number of social service settings. So I'll talk about these in a little bit more depth. To start, let's look at the differences between public and private agencies. So public social services are developed at the federal, state, and local level through legislative initiatives and statutes. So legislation defines, guides, funds, and sanctions these public service agencies. So their authority comes from local, state, and federal laws. How they operate and things like that, the scope of what they do is all dictated, again, by these laws. And they're typically funded through taxes. So to give you an example, one of the agencies that I worked with in my previous practice was with the Kansas Department of Aging and Disability Services. And so their authority comes from the state of Kansas, their rules and regulations and operational procedures in terms of what programs they offered, how they offered them, everything like that, is within is dictated by state legislature as well as CMS, Center for Medicaid and Medicare Services. Okay. And so one of the particular things I worked with them on was around Medicaid eligibility for older adults and those with disabilities. And so that was one of the particular aspects of work that was within their agency scope. So running and administering the Medicaid program for individuals with disabilities and older adults. And then they would actually contract, which we'll see on the next slide, with other organizations, private organizations, to help run this. So they didn't actually operate the program themselves, they oversaw it and administered it. So now, private services, these tend to be their authority to act, their authority and what they, in terms of what they do, the scope, all of that comes from their articles of incorporation and bylaws. So depending on the type of agency they are, whether they're a nonprofit or a for-profit, there are certain articles and bylaws that they have to follow. Their mission really helps to dictate the scope of the work that they do. And their funding sources, we're going to talk about that in more depth, the different kinds of funding sources and how that can dictate practice. But depending on whether they're a nonprofit or for-profit, their funding sources could be wildly different. And actually, in many cases, public agencies, again, they work with both nonprofits and for-profits. So they might actually, we call it privatization. So things that are programs that are dictated that we must have within our state and federal laws often are actually run by nonprofits and for-profits. This is done through privatization. We'll talk a little bit more about that as I give you an example in the next slide. And then another potential option would be independent practice. So for example, a social worker, you know, if you go on to get your master's in social work, you go on to get your license or your clinical license, you may want to be involved in therapeutic services and things like that. So you may actually either have your own practice or work for somebody kind of in an independent practice setting. I'll talk a little bit about that actually, as my aunt has her own independent practice and the benefits and challenges of running your own practice. Again, as I said on the previous slide, so public agencies in the past, they may have administered the program solely by themselves. In some cases, there are certain programs that are still totally administered at the state or federal level. But what's been happening more and more is the issue of privatization, where public agencies actually contract with either for-profits or nonprofits to actually carry out the day-to-day work of this kind of program or initiative. So, for example, again, with Kansas Department of Aging and Disability Services, they have a legal mandate through the state laws to run Medicaid programs for those who are older adults and frail, and those with disabilities who are, so individuals who receive these services have to both pass the financial background or financial eligibility as well as the functional eligibility. So the financial piece is done by another department within the state government, but KDADS then administers the functional eligibility assessment, and they do that by actually contracting with aging and disability resource centers in the state of Kansas. So state employees don't actually conduct any of these assessments. They just oversee the system. They make sure that these nonprofit agencies, these aging and disability resource centers, are conducting the assessments as they should. They're reporting the results as they should, and everything like that. And then the state also contracts out with for-profit companies, managed care organizations, insurance companies, as you might know them, such as Aetna, to actually do the case management for individuals who are proved to be on these Medicaid waivers. So the Aging and Disability Resource Centers decide whether or not individuals are eligible based on a set of criteria. Often this has to do with their functional ability. Would they be able to qualify for nursing home placement or not? And then the managed care organizations actually oversee their care. And the managed care organizations, they do the case management, and they actually contract out then further with a lot of either for-profit or nonprofit organizations to provide the care and services that the individual needs in order to stay healthy and living in their home. So, for example, the managed care caseworker might make sure that an individual has in-home care, that they're receiving physical therapy, and things like that. Often the managed care organization, those staff members don't actually provide those services themselves. They just manage the person's case to ensure that all the things that they qualify for, they're receiving those services. And so, as you can see, the social service setting system is really quite complex. And as a social worker, you could really work at any of these levels. If, for example, you work with individuals who experience depression, anxiety, things like that, you may actually have a contract with the managed care organization to provide those services. Again, the managed care organization reports to the state government. This is what my individual client has qualified for, and these are the services they're getting. So again, there are a lot of different levels, and it's not just simply public or private, but often enmeshed within all of these. And interestingly enough, actually, Missouri, for example, does things a bit differently for the same kind of social service system. So they actually have state and I think county employees who are actually, so they're kind of still state government officials who actually do the eligibility assessments. They don't contract out with a nonprofit. Their employees actually basically do the assessments. So again, this can look very different from state to state. Social services on any type of issue could be delivered in any number of different ways depending on the state that you're in. Okay, so let's discuss a little bit now the differences between nonprofit and for-profit. So just to relieve any confusion, nonprofit doesn't mean that organizations don't make money. This term refers to their tax status, and you may also hear them referred to as 501c3s, for example. And basically this means a couple of things. One, they have some rules around what they can and can't do. For example, 501c3s can't really be involved in lobbying efforts. They also take any money that's generated, any revenue that's generated, and it's invested back into the program and services. For-profit agencies, on the other hand, they have stakeholders and shareholders, investors whom they need to pay. And so the money, revenue that's generated, some portion of that goes to these shareholders. That doesn't mean that they don't invest it. They also reinvest it into their programs and services. And so sometimes you'll hear social workers talk negatively about for-profits and things like that. For a long time, there's been this perception that for-profits are only in it for the money, that they care more about efficiency in terms of providing the bare minimum of services in order to ensure that they make the most money. And in some cases, this is probably true. There are probably organizations that are out there who are more concerned with kind of their bottom line than caring about clients, but this isn't true of all for-profit organizations. For example, many hospitals are actually for-profit. So one of the key things to think about in terms of social work practice and who you might work for is really looking at the mission of the organization that you're working for. Does the organization's mission fit with social work values? Is it something that you can get behind and that you think is really working towards the common good of individuals in the community? So again, a lot of organizations nowadays are, a lot of for-profit organizations, I should say, nowadays are employing social workers. For example, the example I gave you on the previous slide, the managed care organizations, they actually have hired a lot of social workers in the state of Kansas in order to be their case managers. So when we switched to a managed care system, social workers who had been working for the Aging and Disability Resource Centers were then employed by these managed care organizations to continue to provide the case management services. So again, the organization they've worked for now has shifted, the mission has shifted a bit, but a lot of what they do in terms of the case management is still the same. So again, it's important not to, as a social worker, not to immediately demonize for-profit organizations, but instead to really look at the organization, what it's trying to do, and its mission. Now, the other thing that's important to consider when thinking about nonprofit and for-profit companies, but particularly nonprofits, is the funding source. So the funding source could be any number of things. Nonprofits in particular will get grant money either from federal levels or private grant foundations. They may get donations from individuals, and they may have contracts with state or federal governments. And these different sources of funding really dictate the kind of practice that they do, the kind of services that they can offer. For example, if they're working with a researcher, a nonprofit may get a grant to provide cognitive behavioral therapy as an intervention for clients. And so that agency may primarily focus on that type of practice. And in addition, if a new mandate comes down, new money is available, a nonprofit may expand its services or may focus on a different topic than things that they've focused on in the past. So for example, if funding comes down to expand housing and options for low-income individuals, a nonprofit may expand or focus its services on that. So it's important to understand that nonprofits have a mission, but a lot of what they do is also kind of dictated or informed, might be the nicer way to say it, informed by the kind of financial support that they receive. And if you become involved in a nonprofit as a social worker, you could really come in at any level, depending on your level of education and experience. Often what we say is you may start out, for example, as a case manager in a nonprofit, but if you have your master's in social work, you're going to move up quickly and likely be involved in a more administrative role fairly quickly into your career. Just because there's always opportunities for growth and promotion within nonprofits. So for those of you who are interested more in the clinical or independent practice route, I would just want to take a few minutes to talk about both the benefits and the challenges of this, and also discuss why it's still important to have the foundation of generalist social work practice if you're planning to go on and specialize in a particular area. So independent practice, you could do this as an individual, have your own private practice, or with other social work professionals, or even you might have an interdisciplinary collaboration. So for example, you may have a private practice that also that also includes individuals who are, for example, psychiatrists and things like that. So the benefits of going into private practice are that you have a lot of flexibility. So you can specialize in the areas that you want to specialize in. You can specialize in terms of clients. If you really just want to work with veterans around PTSD issues, you can specialize in these areas. So in a lot of ways, private practice gives you a lot of flexibility to kind of decide what your practice looks like. The challenges of independent practice are that it can be very expensive, and managing the bureaucracy around owning and operating your own practice can be rather challenging. So, for example, my aunt, she's the executive director of her mental health agency. And while she has employees per se, most of her employees are actually just administrative assistants. She has about 15 social workers who work at her agency, but they're all private contractors. And so why they've set this up the way they have is that, these individuals each operate kind of their own private practice in a sense. They have their own clients that they see. They specialize in their own areas. However, they work together jointly within my aunt's organization because the rules and regulations around insurance and reimbursements for insurance, as well as liability coverage, are really often too daunting to try to navigate by yourself as a practitioner. And so, if you're working with anyone who's going to be, you're going to be billing for services through any insurance, whether it's through Medicaid or private insurance. The amount of paperwork can be really quite overwhelming. So essentially, what she does is she still sees patients, and she does art therapy, particularly with veterans with PTSD. That's kind of how she got into setting up her organization, but she found that the requirements for getting reimbursed were exceedingly challenging. So she is the executive director, and then she's got the 15 other social workers. They're all licensed clinical social workers who are private contractors, but they work within the auspices of her agency in order to serve their clients. So again, that's their private practice offers great opportunities, but there are challenges. This is also why it's so important as a social worker that you get this initial grounding and generalist practice. Because my aunt, while she, primarily wants to do clinical therapy and focus on that, she has now moved to a position where she not only has to oversee administrative staff as well as other licensed clinical social workers since they work under her. She also has to understand policies and understand the basics of insurance and reimbursement. So the more that grounding that you have as a social worker, the more holistic and well-rounded you are in understanding kind of the different layers of practice and kind of what goes into those, the better you'll prepared you'll be for any level of practice, right? So I know even if you're thinking of just focusing, on education, or if you just want to be that clinical social worker, knowing all the different levels, all the way up to macro, and understanding how policies work, understanding how reimbursement works, all of these things are going to be helpful to you in the long run. So you've heard me talk throughout some of these slides about how funding can really dictate what practice looks like and things like that. So I want to just talk about that in a little more depth. So there are a lot of different types of funding that a social service organization might receive, both for-profit, nonprofit, and independent, for example. So contracts, those are likely, well, those can be in many forms, but often you'll see them, for example, with a public agency contracting with either the for-profit or the nonprofit to provide the services. And so the contract really dictates the scope of work that the organization does, how they're reimbursed for it, their staffing patterns, things like that. So for excuse me. So for example, again, with the Kansas Department of Aging and Disability Services, it contracts with both the Aging and Disability Resource Centers and the managed care organizations. So with the Aging and Disability Resource Centers, their contracts have to be renewed every so many years, in which case they negotiate around the contracts in terms of pay that they'll receive for doing services, any kind of support that they might get in terms of technology, things like that. So, for example, the ADRCs have a contract that they get paid so much money per assessment for Medicaid eligibility that they do. And so, given that they are paid a fixed amount per assessment, the organization then has to ensure that they have enough staff members to conduct the assessments based on the rules and requirements that are laid out in the contract. So, for example, they have 3 days after they receive a referral to be in the person's home conducting the assessment. So they have to make sure that they have sufficient staff to be able to do this. They have to have sufficient technology and resources in order to be able to complete the assessments. They also, because they're paid per assessment, have staff who are trained to conduct the assessment efficiently, right? So they're not paid by the hour. So what really matters is that in terms of the agency, is that they get the assessment done as quickly and accurately as possible. So again, that contract really dictates how the organization runs at least this part of their services. Now, ADRCs also run other services and they receive grant funds and things like that for other programs and services that they offer. But within their focus on these Medicaid eligibility assessments, they're really confined by the rules laid out in the contract that they have with the state for how they can operate things. So now, again, let's move on to grants. So grants are, sums of money that are awarded to social service organizations that submit applications for programs or services. You might also hear them referred to as RFPs, requests for proposals, and things like that. Then there are grants that could be completed or could be administered at the federal, state, or local level, or they could be through private, nonprofit, or for-profit organizations. So the grants that are done at the federal level, for example, there might be research grants that an organization applies for and receives funding for. Often those grants are kind of a weird hybrid where they're a grant, but they're also a contract. It can get a bit confusing, and you need a lawyer to actually really help you figure out all the rules about what you need to do. The grants that are done more by kind of private organizations, for example, Ford Foundation has a lot of grants, both for programs but also for research. These grants are, they put out a call for applications, organizations submit them, and then they find out whether or not they receive them, and then the organization works out a kind of contract with the individual around kind of what the expectations are for getting all of the grant money. So for example, when I apply for a research grant, I have certain deliverables that are often expected as part of that. And so as part of my grant proposals, I submit not only an application, but a timeline of how I'm going to provide each of those deliverables in order to meet the requirements for the grant. Okay. There are also some endowments, and these consist of income-producing monetary or property investments. Some agencies, might obtain funds for an endowment through bequests or gifts by individual contributors. So, for example, an organization that I worked for in the past, because we worked with older adults, often we would be left funds or supplies and wills. And we could use, if the gift was big enough, we could actually use that to set up an endowment. You typically hear of endowments talked about in terms of colleges and things like that. Again, that's money that's kind of put in and invested and really kind of continues to grow. And as a social worker working for an agency, you may be expected to be involved in helping to write grants or in working with your membership base around setting up endowments. So again, talking about the micro, meso, and macro levels of practice, again, as a generalist social worker, having this foundation means that you will be prepared for really any type of work. Again, even if you're going into independent private practice, you likely will need to apply for some grants to either offer seed money, to expand your program, things like that. So it's important to really practice all of these skills and to take advantage of the opportunities within your coursework to work on all of these skills. Okay, and now to the last two, fees for service. This is another way for agencies to get income. Excuse me. So fees for service are another way to get income. And in this case, clients pay for services rendered often based on their ability to pay. So often fees for service are used in the case where individuals don't have insurance, or that it's a type of service that you can't bill insurance for. And particularly social workers, we often set up sliding scales for our clients who have to pay for services, simply because often the people we work with can't afford to pay the full price for our services. Okay, and finally, just to talk about insurance reimbursement again, this is something that's often used, in private practice, but you may also, if you work for a nonprofit and you're providing mental health services or other things like that, be involved in insurance reimbursement. And so this is really where you basically have to provide the service and then just like you do in your day life, then send in the forms to the insurance company to get reimbursed. This, again, is why my aunt has her practice set up in the way it does. Not only is it cumbersome to know all the rules and regulations around getting reimbursement, but the delay in time that it can take to get reimbursed can mean that you really need to have a solid financial base in order to be able to have your own private practice. Okay, so now that we've talked about how social work's authority and kind of guidelines for practice come from our social service settings, let's talk a little bit about social work credentials and how those give us both the authority to act and help guide our practice. So there are kind of two sources of credentials. First, we've got the Council on Social Work Education, which accredits our social work programs. So throughout the world, there are many schools of social work. Not all of them are recognized in the United States, not all of them are recognized by CSWE. And it's important to go to an accredited program such as UNCW because that really gives your degree weight and authority. So organizations recognize that you went to a school that is an accredited program. So that helps just in terms of the employment process. It's also important in terms of going forward with your education. For example, going on and getting your MSW, hopefully you'll get it from UNCW, but if not, if you go to a different school, they would look back and see if your BSW came from an accredited school or not. Same with going on to get a PhD. For those of you who are interested in research, you would need to have an MSW from an accredited university in order to go on and get your PhD. So again, the CSWE gives us authority in terms of it's a recognized degree, it's a respected degree, and as you move out into the field, you'll find that social workers are often highly sought after, particularly in fields that are really expanding, like gerontology. Because it's recognized that social workers, and particularly those from accredited programs, come with a solid foundation and skill set that makes them highly desirable as employees. Okay. Our other set of kind of credentials or authority comes from the NASW and states, and these are in terms of licensure. So there are different levels of licensure, and they often are called different things or have different acronyms from state to state. So if you decide to go on with your education as a social worker, you'll want to see what the licensing requirements are in your state in order to practice, because it does vary from state to state. So much like lawyers, there are different standards from state to state in terms of the bar and things like that. It's the same with social work. So thinking long term, you want to think about where you want to practice and things like that, and figure out what the licensing requirements are. There are also requirements around continuing education so that we as social workers continue to stay abreast of the best information, best interventions, and things like that. Now, in addition, CSWE, our education program, we'll talk a lot about the values and ethics that guide our social work practice in the next module, and you'll get that throughout your social work education, because that also really helps to dictate our practice. It also gives us the authority to act. So, for example, issues around social justice, as part of our values, that is an area that we are, as social workers, are really expected to focus our practice. And so for the last bit of the class, I just want to talk a little bit about service fragmentation and the challenges that that presents to the individuals that we work with, as well as ourselves as social workers. And so again, I'm going to go back to the example of the Kansas Department of Aging and Disability Services, but this time we're going to look at it from the viewpoint of an individual. So instead of going top down, we're going to start with Joan and kind of look at what this whole system might look like from her perspective. Right? So from Joan's perspective, say she's an individual with a disability who's applying for services. She's going to go through one organization, the Aging and Disability Resource Center, just to get the functional eligibility. Then she might work with an MCO if she's found eligible. She might not, depending on the state, it might also be a different organization. But the other things that she's going to have to try to negotiate with the MCO or by herself include the Medicaid financial eligibility. So again, in the state of Kansas, for example, these are two different branches that deal with that. So for example, while she may be found to be functionally eligible to receive Medicaid services, there may be a holdup in terms of her finding out if she's financially eligible. So she may have to wait some period of time before she can even start services, because these two different branches, A, maybe they aren't in communication, B, maybe one's lagging behind the other, right? And so that just in itself could lead to Joan falling through the cracks, right? If she has to wait for services to start, her health may decline, something may happen, and she may end up in a hospital or a nursing home as a result. All right. Then there's all these other services and systems that are often disjointed that Joan, either by herself or with the help of a case manager, may have to negotiate. Right. So transportation services are often run by one organization or another, or depending on the type of thing that she's trying to get to, each organization may have their own kind of transportation, right? So she may try to get transportation services through the city. Or if she's an older adult, she may be trying to get transportation services through a senior center. Maybe through the apartment complex that she works in. There's all of these different potentially private organizations that she may have to negotiate with to get from point A to point B. All right. If she wants to receive mental health services, she and her case manager, may have to find one that's within their network. Again, that's a whole separate thing, and in which case then she probably has to negotiate transportation services to get there. Then, say she wants to eventually get back into the labor force, she may have to work with one or more agencies around vocational services. Again, if any one of these things kind of slips up, Joan may, or it doesn't come through, or there's a problem with the organization, Joan could fall through the cracks. And it's so easy with all of these different systems. And this is just a broad example of them. Within each of these transportation services, there could be 3 different organizations that she has to negotiate with. Mental health services, there could be several organizations, plus the transportation to get there, plus the issues around insurance reimbursement, out-of-pocket costs, all of that, all of these different things. So, there's this whole web of services that Joan needs to access in order to live a healthy and happy life. But all of these tend to be isolated organizations, for profit or nonprofit, that she has to negotiate with, that may come into her life, may come out of her life, depending on, if they close down, things like that. And so all of this is kind of what we refer to as service fragmentation. So even though Joan may work with a case manager who may help her to try to access all of these different services, she still has all of these kind of siloed services that are supposed to provide her with things to help her live her life. However, often these are, simply band-aids on the underlying issue. For example, Jones, if she has a disability, the underlying issues may be that she needs a steady income to help her get back on her feet, to help her afford the supplies that she needs. For example, a powered wheelchair, things like that. There may be, maybe she can't afford to live in a place that's both close enough to where she could work, that would allow her to easily negotiate that. It could also be that, for example, if she had an accessible car, she wouldn't need the whole transportation services, things like that. However, accessible vans in particular are ridiculously expensive. They're beyond expensive, and so Joan can't. Joan may not, probably isn't able to afford them. So again, all of these things, she has all of these siloed agencies providing services and supports. Agencies that provide in-home services could include those who provide physical therapy, those who provide some housekeeping, those who provide respite care if Joan has a spouse, things like that. And these could all be separate, again, organizations that don't talk to each other, that just kind of come in, do the basics of what they're supposed to do, and Joan's, still stuck with kind of what she's got. Um, and Joan, for example, is also always at risk. For example, if Medicaid funding gets cut, she could then lose any or all of her services. There's always risks to our clients because they may experience reductions in access to services. Either the organization closes, or there's no longer funding to provide that. Or that these organizations don't talk to each other, so she's can't access them as completely or as fully as she wants to. Now, this is also a very frustrating system for social workers and other helping professionals to live and work in. If you think about it, imagine trying to be the case manager for Joan and trying to coordinate all of these different services. And, each of these services, the organization may or may not be a competent organization. Maybe they have billing issues. Maybe there's somebody who, whoever their administrative staff is, doesn't pass on your messages. All of these things. So not only does Joan experience a ton of frustration trying to navigate this fragmented and siloed system, but social workers and case managers can be exceedingly frustrated in trying to manage all of this, where in the end you're just trying to do what you can to keep the person kind of alive and functioning. You're probably not even able with the time to necessarily really dive in and make sure that Joan on a kind of emotional level, on a human level, is doing well. And often as social workers, as it discussed in your book, often we don't take the time to necessarily look after ourselves in the way we should. Because all of this trauma and frustration that Joan is experiencing, we as social workers also experience. And so it's also really important for social workers to take care of themselves, to be doing, to really be involved in self-care, whether that's going out for walks, whether that's getting your own therapist to talk to, any number of those things really can help you be more effective as a practitioner, simply because it's so very easy to get burned out when we work in such a bureaucratic system. And so on the next slide, what I'm going to have you guys do is watch a video. Well, the woman is from Great Britain and she talks about the social service delivery system in Great Britain. However, it has a lot of similarities to the US system in terms of the fragmentation and the inability of us to have the time to connect to the people that we're working with. So to help us think a little bit more about service fragmentation, I'd like you to watch the accompanying TED Talk. And again, you can get to that by clicking on the iCard link or by looking or clicking on the link in your Canvas and watching the video through there. And as you watch, I want you to think about some of the examples of service fragmentation that you've seen or encountered in your personal or your professional life, or maybe stories you've heard from friends. I also want you to think about why services might be so fragmented in the United States. So the examples you're going to see in the TED Talk come from England, but many of the ideas and concepts carry over to the United States as well. So again, reflect on these as you're watching the video and share some of your thoughts in your journal. Okay, this wraps up eclass4 in Module 2. Remember that you've got your journal reflection 1 and quiz 1 coming up. Review the rubric before you do journal reflection 1 so you know kind of how I'll be grading and what all you need to complete for each section to do well on it. Remember, and I should have said this in the review for quiz 1, the quiz is open note, open book, but remember there is a time limit. So make sure that you are familiar with those key terms in each of the e-classes so that you can move through the quiz in the amount of time that's allotted. Again, if you have any questions, send me an email. You can post on Canvas. I will be checking our discussion board in case there are any comments or concerns as we move into these kind of more assessment pieces of this module. Once you've completed this, after the journals and journal and reflections and quiz, I will be posting Module 3, which will have the e-classes and material for the next section. Again, questions, comments, let me know, and I will see you in the next e-class.